welcome to the Precious Show. Today is another segment on the Precious Show. Thank you so much for your messages, for not seeing Precious for 2 weeks. I'm very grateful. That shows your commitment in watching the Precious Show. Precious is back to your screen once again. And today we are in the month of October. We are coming to discuss on breast cancer. I have one beautiful lady beside me, Auntie Ness. Her name is Delali. Welcome, madam.
Thank you.
See, I can't mention all your names, so it's better you mention everything.
Okay, so I'm loving at the Lalihood.
Okay, we'll go straight to the point, my dear. Yeah, sure. Breast cancer, what is it? Give us the details of breast cancer.
Okay, so good evening to you.
Sure.
Immediately. So breast cancer, I believe we've heard a lot. So cancer is like an abnormal growth of cells that has a tendency to spread. Okay, so if we talk about breast cancer, then we are talking about abnormal growth of cells in the breast. Okay, so that is breast cancer.
That is breast cancer.
Yes.
Okay, but why do we put on that pink? What does it stand for?
You know, women in pink.
Okay.
Yeah. Women and our love for pink, and it's also believed that the first man to create the awareness about breast cancer used pink in these letters. Okay, so that's also a reason for the pink.
Viewers, we are in the pink month.
Yes.
What causes breast cancer?
Okay, so the exact cause of breast cancer is not known, but then there are some factors that put you at risk for breast cancer. It also doesn't mean that if you don't have a risk factor, you can't get breast cancer.
Okay.
And it also doesn't mean that once you have a risk factor, automatically you would get breast cancer. You get it?
Sure.
So the risk
Come
factors
down to our level.
come to our level.
Yes. So let my viewers understand.
So if I'm talking about risk factors, then I'm talking about things that makes you at risk, things that can predispose you to getting breast cancer.
Yes,
You get it? So the first, then these risk factors, I would put them into maybe modifiable and then non-modifiable. If I talk about the modifiable, those that we can do something about.
yeah.
Yes. And then the non-modifiable is like you can't do anything about it. If you have it, you have it. There's nothing you can do about it. Yes. So the non-modifiable, then you can talk about you inheriting it. Okay. So if you have a family history of breast cancer, then you are at risk for breast cancer. It doesn't mean by force you get breast cancer. It just increases your risk of getting breast cancer. So those are the non-modifiable risks. Now if we talk about the modifiable ones, those we can do something about. Then we'll look at our diet. Okay.
Dietary factors.
Yes. So the sugary foods we eat, the canned foods and all that put us at risk. And then research shows that eating 1 egg a day reduces our risk for breast cancer by 18%.
A day.
Yeah.
Let's be clear.
Yes.
A day you have to take 1 egg. Not 2, not 3, not 4.
At least 1. And also alcohol. Research tells that if you should drink an extra drink, okay, taking too much alcohol, it also increases your risk of breast cancer by 7%. So anytime, the next time you go for party and taking the alcohol, remember that you are increasing your risk for breast cancer. So adding to the non-modifiable, we talk about our age. As we grow, our risk for getting breast cancer increases. And we can't do anything about it. Definitely you will grow. So for that one, just bear it in mind. Okay. And then now, being obese.
Yeah, obesity.
Yeah. And I'm glad that of late most ladies are doing the slimming course. You all want to be slim.
Of course, we want to be more sexy.
It's sexy. Slim and cute. Yeah, so it's good. We need to work on that. So if you are obese, then you should be doing something about it. If you have a good weight, then you should work on maintaining your weight, because being obese also increases your risk for breast cancer.
Okay.
Yes. So those are some of the risk factors for breast cancer. And also, it's also noted that those who give birth, your first pregnancy, after age 30, increases your risk. So in as much as we are fighting teenage pregnancy and all that, it is also advisable that we give birth early, at least 1. Which I hope you understand.
Yes, sure.
Yeah. So that's another reason. And then The postmenopausal women, they're also at risk.
Okay.
This is because, menopause comes with so many changes and discomfort and stuff. So most women are tempted to go in for hormone replacement therapy. So in that case, you are increasing your risk for breast cancer as well.
Viewers, she has spoken about dietary aspects, the food we eat. If you are taking more alcohol, then you should know that you are getting close to getting breast cancer. Do we have a specific age group that suffer from breast cancer?
Okay, so breast cancer can affect anyone at all at any age, but then it is more common among the old women. So once you're a woman, you're at risk. But the older you get, the more you are also your risk of getting breast cancer increases. Oh yeah.
And what of men? Do they suffer breast cancer also?
Oh yeah, sure.
Men.
Breast. Just that breast cancer is not common in men as it is in women. Okay. In the US, 1 out of 100 men is that's the incidence. Okay. 1 out of 100. So the rate of breast cancer in men in the US is just like 1%. Okay. But in Ghana here, it will surprise you to know that our incidence rate for breast cancer in men is 2.9.
Hey!
Yes. So you see,
This is serious.
serious.
Viewers, I learned men also get breast cancer. So we are not the only people who experience breast cancer. It's not only the ladies or the women that do experience breast cancer. The men also do. How can we prevent it, Mandy?
Okay. So prevention is better than cure.
Exactly.
Yes. So I was talking about the modifiable risk factors. So to prevent breast cancer, then we are supposed to work on these risk factors that we can to help us prevent them. So like as I said, the diets. We have to work on our diets. Those of us who like the sugary foods, I'm one of them. I'm working on it soon.
Nice. Okay.
Nice. Yeah, but
It's good that you are speaking the truth.
Yeah.
These are some of the things we
some
can't
of us we
avoid.
like drinking the sugar. Like we drink it, we don't just take it. Yeah, so you have to work on that. The fast foods, yes. And then less alcohol. Yes, we party and all that, but then let's reduce the binge drinking. We need to work on it because anytime you are taking alcohol, remember you are increasing your risk for breast cancer. So we need to work on that. And then let's work on the egg, fish, and those things. All those helps, okay. Then we have to work on our weights. Giving birth early. You get it. So it's better to get pregnant before the age 30.
I think you should try and then coin that sentence very well, because there are people who are also talking about teenage pregnancy. So if you say we should give birth early, it's going to trigger a lot of things. Yes.
I get it.
Yeah.
So yes, we are fighting teenage pregnancy. So I'm not saying that because you want to escape breast cancer, drop out of school or go and play the adult game. No. Yeah. But then there are some people that I have to be 35 before I give birth. Some ladies feel like I need to enjoy life before I start making. No, that is not it. If you are ready, you can just go in for it.
Okay. That's the word. If you are ready, then you can give birth. If you're ready, you can cater for the kids.
Yeah.
Then you should give birth early before 30. Please, where do you work?
Okay, so I work at St. Martin's de Porres Hospital, Agomanya, in the Eastern region.
Okay. Thank you so much for having you on the show. But before you go, you have to demonstrate how we need to examine the breast.
Okay.
So,
alright. So to examine our breast, okay, it's advisable we do it within a week after our menses. When we are menstruating, the hormones are at work and all that. And then the breast during ovulation and menstruation, there are changes in the breast.
yeah.
So if you examine your breast at that period, you can't really tell if there's something wrong, because during those periods you see that your breast is tense, it's heavy and all that. But after your menses, you realize that the breast is relaxed, so you can do that So you can do that maybe even in the bathroom.
Okay.
You get it. You just stand in front of the mirror, inspect your breast, just observe the breast, look at the size, the color, if there's any changes, your nipple. So you look at all that. Then when you finish, then you can now go ahead to examine your breast. So you can do it standing or lying down. If you're in the back, as definitely you're going to be standing. If you're in your room, so you stand in front of the mirror, put your hands in your waist, do your inspection. When you finish, you are going to use your 3 fingers, okay, to examine the breast. So you put the hand of the breast you're about to examine behind your head, whether standing or sitting or lying down. You are doing the same thing. Then I'm going to use the second hand to move around your breast. Okay, so you are moving. You know the breast extends to armpits area, so you have to go all through that side. So you move in a circular motion around the breast. Make sure you cover the entire breast. Then when you finish, you squeeze the nipple a little gently to see if there's any discharge. The discharge will be yellowish or has blood in it. So if you observe any of such, then you see your doctor. You get it. So when you finish, you repeat the same for the other breast. So every month, it's not a one-day affair. The more you do it, you get accustomed to your breast. So that if there's any change, you'll be able to tell there is any change in your breast. So that is it for the examination.
Okay.
And then it's not only the examination that can identify it. So it's advisable we also go for the screening. So we can just visit them and then have our breast screened. Okay. Thank you.
Okay. So now we'll move to the practical room so that you do a little practical with the physical person.
Yeah, it's very necessary.
Yes.
So before you examine your breast, you would have to inspect it. So I'm going to start by inspecting your breast. Okay. So inspecting the breast, you have to look at the color. If there is any color change, you want to see if there is any change in the size. Please, are you getting it? Yeah. So we inspect the breast. Then I now go back to examining it. So I'm starting with. So you would put your hand under your headphone. Okay. Yeah. So what I'm going to do is that I'm going to support the breast this way. Then I would use 3 of my fingers to palpate. So I'll go around in circular motion to feel for any lump. You get it? So starting this way. You're going this way. Please, if you feel any pain, let me know. So I'm going to do this till I cover the entire breast. Then I would have to gently squeeze your nipple to see that if there is any discharge. Okay, so you don't have any discharge. So all done for this. I'm going to repeat the same thing for the right breast. So you put this hand down and you put that. Okay. So we are still going to support the breast. Then you go again with our 3 fingers. So if you feel any pain, you can let me know. So as I did for the previous one. Okay. So that is it.
So my viewers, you saw the lally massaging somebody's breast. Was that breast bigger than your hand?
Oh,
yeah. You've been seeing it almost all the time.
Yeah.
Okay, it's a medium size.
Yeah.
Okay. That is good. We are very grateful for having you on this show.
Thank you.
Thank you so much for helping us to bring this topic.
Thank you
on
for
board.
having me.
Sure. We are very grateful. Viewers, I hope you've learned something new. I hope you didn't watch Breast and forget about whatever the lady said. Please. That brings us to the end of today's episode on The Precious Show. My name is Beatrice Lavi. Please remember to live safe, you think safe, and work safe. Until then, bye.